So yeah, I mean, our journey in peer-to-peer naloxone started with inspiration from Scotland. Actually, we we saw I was with Prun, our medical director, and we watched a presentation by uh, Steph Kerr and Jason Wallace at a HIT conference, and Prun just turned around to me and said, "We've got to do this. This is the way forward." And it was that that's all he had to say, and that was my mission to go off and look at how we did that. So then myself and Mark Pike went up and met with Kirsten in Edinburgh and picked the brains basically, and just ruthlessly stole all the material, um, and what we wanted to do with the resource pack was something after the training. So we did a day basically with the guys and girls who on overdose prevention, what to do in an emergency, and naloxone procedures. Amanda Taft, who's the service user involvement lead in St Helens, picked the baton up from there. She done a lot of training around boundaries, confidentiality, keeping yourself safe, all that type of stuff that we want to make sure that people feel supported. So the success of it has just been outstanding, really. So I think we had a refusal. Well, sorry for the dry language, but accepted and offered and accepted is what we record on our database as like a percentage. And our national sort of rate is about 40% offered and accepted, which isn't good enough, really. And the offered and accepted rate in St Helens shot up to nearly 70% with the peers. Oh, there you go. I'm jumping ahead of myself. So yeah, 64% from 47, and that's just that the peers, the message, the power of that message. And I'll quote Jason. I said to Jason, one of our peer educators, "What's your secret? What? How come you've had so much success?" And he said, "We just don't take no for an answer." He said, "It's not a logical response. No, I don't want an naloxone kit if you're using opiates." And I think that sort of challenges the professional offer a little bit. I think we do sort of back off a little bit. If someone says no, then oh sorry, didn't mean to offend you, or all these things that we hear. And I think for the peer to say, "I'm not going to say no for an answer. You're using opiates. You're at risk of death, and you're gonna take this life-saving medication." And as George says, it's the power, isn't it? It's the power of one drug user, sort of ex-drug user, current drug user, doesn't really matter, helping another. And I think people do listen more. So yeah, we give the guys and girls hoodies, and there's Rachel with the police there. We got 3 bikes from the local police force, which are like stolen, recovered. So they give us them for nothing. And we got the hoodies, and then we thought about what does a resource pack look like. So what we wanted to do, as I said, is like do something. You got your day's training and then the other training, but a resource pack that people can dip into, and very much like a post-course sort of reading guidance, and something that people can keep in the backpacks, really. So we looked at why we wanted to do it, the vision and values of CTL, and why this was a really important project that we wanted to take up, and then sort of guided the pack in terms of what we wanted people to feel supported by. So we started with a list of numbers that Siobhan put together, which is a local resource, sort of, what if someone gets stuck, or they need to ring someone or signpost someone, all those numbers were included. Then we sort of done some post-course learning, so just a refresher really. So just for people to fill in themselves, you know, just examples of refreshing the training really. Key messages were included. What to look for when we recognising the signs of an opiate overdose. Because I think what we realised is that, you know, you can take, we all go on training, don't we, and we all come away and you retain, I don't know what the percentage is, but probably a small percentage of what you've learned, and it's the post-course sort of learning that you need to think about, applied learning. So we want to just refresh people's thinking around that. I don't know whether it's an issue nationally, but there's still that myth that if you're going to call an ambulance, that the police are going to come, and you know, trying to dispel those myths and say it'll only be if in the event of a death, or if the paramedics' safety is at risk. And there's our St Helens doctor, Jeff, who's a Scottish man, as it happens, and Jeff sort of sharing the message around Doctors ABC. So we just refreshed the recovery position as well, and what you know, reminding people what that simple steps to get people in a safe position. We covered about how to inject naloxone and the best part of the body to go in, which we always sort of say the upper outer thigh as the first point, but if you can't get to there, then it'll be the shoulder areas. And really important is, I don't know how many times we've heard about people getting brought back and then do one really, get on the toes and get off, which what we ask the peers to do is really try and stay with the person until the paramedic comes and emergency help. So yeah, we summarise all that into the learning, and we also talked about safeguarding and loan working, which is something that we were cautious about really. We didn't want to set anyone up to fail. So in St Helens, we've got Jason, John and Lena, all they work in pairs, so they go out together, and I think that's probably our default approach to things. But when we talk about lone work, and we're talking about, you know, two people being out on their own, and sort of, you know, safety mechanisms for them. We built in some reflective practice. It was like self mapping really about, you know, what the responsibilities of being a peer educator. How do you know that you've been successful? Your strengths and barriers to your strengths, and getting people to think about, you know, how they're doing. And we finished with legally we've got to have a volunteer agreement. This has taken our lead from our chief pharmacist Mohammed, and he said basically it's great that you've got peer educators, but they need to sign up to be a volunteer to legally represent us, and that's part of the law. And what we try to do is keep that as simple as possible. So no expectations about, you know, want you to do X amount of hours, or we expect this from you, we expect that from you. Basically, we just want people to come and do what, you know, the minimum or the maximum that they want to do. But the legal agreement needed to be in place to cover us legally. And there's our guys. There's the power. There's the power behind it all. Amanda, Lena, John, Jason, and Rachel, the boss. And that's us.